Hi, my name is Phoutrides and I am an OB fellow in Boise, Idaho. I had a few pearls about obstetrics that I think all family doctors should know that I wanted to share with you today that have been solidified during the course of my fellowship. The first one that I wanted to share was a review of when to use amnio infusion. Sometimes I think it can be a little confusing as to when to use which labor interventions. So to review, an amnio infusion is best used when somebody has known low amniotic fluid volume, as well as recurrent variable decelerations. It's not a helpful intervention if somebody has normal fluid or if they're in the second stage of labor. In the appropriate clinical context, it will help only about 50% of the time, but in those cases, it can be quite helpful. The second pearl I wanted to share was kind of a review of when to use or consider antenatal steroid administration. So based on the most recent ACOG guidance on this issue, which was reaffirmed in 2020, antenatal steroids are given to folks who are between 24 and 34 weeks. They get a dose of betamethasone, 12 milligrams, 24 hours apart. And these are for people who are at risk of delivering within 7 days. You can consider giving a single dose of antenatal corticosteroids for folks who are between 34 and 37 weeks as well, again, if they have a high risk of delivering within 7 days. You can consider repeating the dose for somebody who receives them before 34 weeks if after 2 weeks they are still pregnant and still below 34 weeks. However, repeated doses of antenatal corticosteroids have not been shown to be beneficial and may show some evidence of fetal harm. The final pearl that I wanted to review was just kind of the most recent guidance on preterm pre-labor ruptured membranes, or Pprom. So previously the guidance suggested that all of these folks should deliver by 34 weeks. The most recent guidance suggests that if somebody is to get to 34 weeks and they haven't gone into labor on their own and there's no evidence of infection or any other issues, you can consider having these folks deliver up to as late as 36 weeks and 6 days with shared discussion with the patient, which is a change from the previous guidelines that said everyone should deliver by 34 weeks. Thank you so much for your time. Take care.